Well, hello everyone, and a huge hello and thank you to Tracey, who's taken some time out of her day to talk to us today all about sleep. So if you're someone who maybe struggles to get off to sleep, perhaps you're waking up in the middle of the night, maybe you have a disturbed sleep because you have a partner who snores, or perhaps you wake in the morning and just never feel rested. And it may be that you have tried different pillows, tried different mattresses, changed the temperature of your room, perhaps changed a few things about what you do before you go to bed, and you're still struggling. Have you ever considered how you breathe could be impacting the quality of your sleep? That's what we're going to be talking about today with Tracey. And before we get to answer all of those wonderful questions, Tracey is a functional breathwork instructor. If you just let us know a little bit about what that is, what that means.
Thank you, Lorna. So functional breathing is all about understanding two things. It's the blood chemistry, so how oxygen and carbon dioxide interact in the blood. And secondly is the biomechanics of the body, so how the respiratory muscles move. And the ideal form of functional breathing would be light, slow, and deep, using the nose with the diaphragm, with a gentle pause after the exhale. And that's what we teach in my courses and try and encourage people to relearn to breathe.
Brilliant, perfect. So in your mind then, I guess if I say to a lot of people, breathing and sleep, the first thing that comes to mind is snoring. But from your perspective, looking at things more holistically, what is dysfunctional breathing for someone when it comes to sleeping?
Well, this is really all about airflow through the airways. And if you imagine a large volume of air passing through a very narrow space, this causes the nose and the throat to vibrate. So essentially that would be snoring. But as you rightly say, it could be so many other things. So for example, raised levels of cortisol in the body at night, that a racing mind, higher heart rate, all of these contribute to preventing us getting into our sleep cycle and actually having a restorative night's sleep.
So that's our stress hormone, isn't it? When we talk about cortisol, that's the thing that's being rushed into the body at moments when we're sort of stressed or anxious or a lot of worry and busy minds, as you say. And
modern life is very much indicative of poor sleep, because a lot of us are on our screens late at night, and the blue light from iPads, computers, phones, that actually triggers a signal in the brain that it's still daylight. So the brain almost wakes up and it starts becoming a lot more active, when actually our circadian rhythm, we want it to start to slow down before sleep. So reducing screen time is really important. Or if you are a night worker, you can actually get orange tinted glasses specifically for blocking out the blue light from screens, which will help reduce that impact on the brain. Human beings are just extremely sensitive to light exposure, and more so than we probably think. So the general advice is to avoid screens or blue light for up to 2 hours before you go to sleep. The other areas to think about, as you mentioned before, temperature in the room. It should be around 16 to 18 degrees Celsius on average. You want that room to be cool, because once you're under the duvet and the body starts to go into the sleep state, your body is going to adjust. And if it's too warm, you won't be able to get into that sleep cycle. Sound, of course, I know that some individuals are very sensitive. When we say light sleepers, having earplugs, a very simple, helpful tool, blackout blinds, an eye patch, if that helps. And very much, thinking about food and digestion, we don't want to be eating a big meal just before we go to bed. So it takes on average 3 hours for food to digest. So really, you don't want to give the body more reason to stay awake just before you're trying to fall asleep.
Yeah, waking the system up just before you try and let it all relax and calm back down again. So if we talk then back to sort of the breathing, I mean, they're fantastic tip, and yeah, very important, that kind of, I guess we call it now sleep hygiene, don't we? But when we talk about sort of the breathing side of things, why is it that nasal breathing or nose breathing is so important when it comes to our sleep?
Well, our mouths were never meant for breathing, and we have the science now to back this up. So really, our mouths are for eating and drinking, speaking, and for short spurts of high intensity sport when we need to breathe through our mouth. But the nose is very unique, and it can be compared to the gut in terms of the fact that it's its own microbiome, and it has the ability to purify and has antibacterial qualities, as well as warming the air before it goes into the lungs. The mouth doesn't have any of those facilities. And the other interesting thing with nasal breathing is the fact that we have a molecule called nitric oxide, which is only produced in the sinus cavity. And what's so interesting about this molecule is that, along with carbon dioxide, it is a vasodilator. So it gently opens those blood vessels to allow more oxygen-rich blood to get to the lungs. And that's really important because, again, it's not produced in the mouth. For sleep in particular, being able to slow down our breathing rates before bed is very important. And there are simple exercises we can do to encourage that. And that what that does is it moves the body from the typical fight or flight active state into the parasympathetic rest and digest state. And you almost need a few moments to just get the body into the right state before it moves into the sleep cycle. And that's what correct functional breathing can help with, is calm the mind, reduce the heart rate, and prepare the body for sleep.
Brilliant. So it's almost like helps with that transition between our busy, active daytime kind of alertness and taking that body, helping take that body down into that restful, peaceful sleep, like you say, rest, regenerate, digest phase of our sort of 24-hour clock, as it were. Fab. Go on.
I was just going to say the other thing with nasal breathing is really key if people are suffering from insomnia, snoring, and sleep apnea. Because you can literally eliminate these problems with correct nasal breathing. And when we say correct, that's the mouth closed, and it can take practice. You know, if you've been a mouth breather all your life, suddenly having to breathe through your nose, it's essentially relearning, reteaching the body and the muscles, all of the respiratory muscles to perform differently. But the long-term effect is worth it, because when the breathing muscles are working in the right way, it takes pressure off the cardiac muscle. And this is particularly important with sleep apnea, because, you know, people sadly have passed away in their sleep because they haven't been able to breathe. The heart hasn't been able to cope. And it is an issue that actually gets worse with age for men and women, particularly if women are going into the menopause, progesterone levels dip. That really affects the quality of the upper airway muscles, and that can really cause poor sleep habits, even if you've never had poor sleep habits before. So preventative measures, getting people to breathe correctly so that they're not just breathing well during the day, but they're also breathing well at night, can literally save lives and help the body perform optimally. And I know you and I have spoken about a product that that is essential to helping that process, called Myotape.
Yeah, because I was going to say, a lot of people probably thinking, well, if I sleep with and have my mouth open when I sleep, how can I correct what I'm doing when I'm sleeping? So there's exercises, as you said, that we can be doing during the day to train the body into more naturally breathing through the nose. But there is this great product. I've got some myself because I might be known to snore every now and again, very quietly, I'm sure. But waking, I know I mouth breathe too much, like most of us. waking a bit sort of bunged up in the nose, dry throat, needing to clear my throat in the mornings. And so as a sort of a quick fast track, I guess, to helping the body prioritize nose breathing over the night, it's this thing called Myotape. So tell us a little bit about Myotape. Just get that on the screen there.
The Myotape is a very simple preventative measure to assist with nasal breathing at night. And there's no tablet you can take to stop snoring or stop sleep apnea. The only proven cure through scientific testing has been changing to correct functional breathing, as I mentioned before, light, slow, deep, through the nose, using the diaphragm, 24 hours a day. But at night, obviously, when you're sleeping, you're not aware of how you're breathing. So the tape essentially sits around the outside of the mouth, and it gently pushes the lips together, forcing the body to breathe through the nose. But it doesn't seal the mouth. So, if you wanted to talk or have a sip of water, you still could, because it's very comfortable, stretchy tape. But that tape essentially retrains the facial muscles. And mouth taping has been used extensively in dental and oral hygiene to help post-surgery, because you don't want any bacteria getting into the mouth and causing inflammation and problems. So taping was used for that, but actually the knock-on effect of using it absolutely retrains the body to breathe through the nose. So the combination of the tape and the active practice of functional breathing through the nose together can really help eliminate sleep apnea, even waking up in the middle of the night and getting back to sleep, helping you to get back into that sleep cycle, and just restoring correct breathing habits.
And yeah, I can vouch, it looks a bit weird and sort of unusual, bright orange around your around your face, and there are other ones now that are more of a sort of a skin, tan color, aren't they? But it does feel pretty comfortable, to be honest. You're aware of obviously something on your face, but it isn't an awareness of any anxiety or concern you're not going to be able to breathe. It's let's say the first night I tried it, I got to sleep absolutely fine, and the difference the next day in terms of kind of congestion and clarity. So yeah, that's a really, really simple way to kind of integrate more appropriate breathing to help with our sleep. Are there any other advice you can give in terms of how we can incorporate better breathing techniques to help improve sleep quality?
Yes, it's really important to mention tongue positioning as well when we talk about sleep. So for example, with snoring, when you breathe through your nose, mouth snoring will stop. And nose snoring will stop when you unblock your nose and correct your breathing patterns to normal. And that can be practiced using the tape. But with the tongue position, ideal positioning should be the tongue resting on the roof of your mouth during the day and when you sleep. And obviously, if you're sleeping with your mouth open, the tongue is going to fall back into the throat. And that's a real problem, obviously, and it causes sleep apnea because it blocks the air tract completely. So by relearning to breathe correctly through the nose with the mouth closed, the tongue position will change. And that is, as you know, it's all connected. And that is a very important part of reestablishing correct breathing habits at night.
Fantastic. Yeah, it's the thing is, it's all the pieces of the jigsaw puzzle kind of putting it together. And I know you mentioned, obviously, there's certain exercises that people can do to start changing the way they're breathing during the day and getting the body into that habit of nose breathing. Can you just tell us a little bit more about, I know you run some courses and workshops. How can someone find out more about that if they're wanting to explore this a little bit further with you?
Well, in terms of the exercises, they are widely available through the Oxygen Advantage, which is the certification program that I've worked with. But I find with something as personal as breath work, it really helps to have a guide. That's how I learned. It really makes a difference when you've got someone who can work with you personally or in a small group. So I work on Zoom. I do monthly group courses, and we focus on how to incorporate these exercises into your day-to-day life. For some people, they'll actually allocate 15 minutes a day and do them. But for the vast majority, it's about incorporating the light, slow, deep breathing techniques in their daily routine, whether it's during exercise, when they're driving, making a cup of tea. You can literally take 90 seconds and calm the breath down, just breathing slowly in and out through the nose, preferably with a longer exhale, and that will immediately reset the nervous system. But change breathing habits. Remember, we're working with muscles, and muscles can be trained. So I'm very happy to share knowledge and information, and people can reach out to me directly.
Fantastic. Yeah, I mean, like you say, just that one takeaway being pause, acknowledge whether you're breathing through your nose and mouth, and try just 90 seconds of nasal breathing. I know I'm better at catching myself, like say, whether it's with a cup of tea or standing in a queue at the supermarket or post office, just to get that kind of mindset going again. But we will definitely put links around the video as well of how they can get hold of things like the Myotape, how they can read and learn more about it, and how they can access your courses and workshops that are available as well.
Thank you, Lorna. That was a wonderful conversation.
Brilliant. Yeah, no, thank you ever so much. I hope for you watching, that's giving you some insight into sort of another avenue you can look at if you're struggling with your sleep. A couple of simple things you can do to get started, and as we say, some more information below the video on how you can take this further. But thank you very much, Tracey, for taking the time out to share your knowledge and wisdom with us today.
My pleasure. Thank you.
Thank you.